There is one more autoimmune disease called as lupus erythematosus. Okay, this is also an autoimmune disorder and it is very common collagen vascular or connective tissue disease. Basically, the connective tissue of our body will get affected. There will be autoantibodies that are directed against the connective tissue present all over the body. There are basically three types. A major form is called as systemic lupus erythematosus. As the name indicates, it is a serious multi-system disease with a variety of skin and oral manifestations. The cause is not known, but there seems to be an increase in the activity of B lymphocyte and abnormal function of T lymphocyte. There is one more localized form which is called as chronic cutaneous lupus erythematosus. Here the prognosis is generally good. And subacute is, it has clinical features intermediate between systemic and the chronic cutaneous type. Systemic lupus erythematosus is a disease which is very common in women. About 8 to 10 times more common in women than in men. And average age at diagnosis is about 31 years. And common findings will be fever, weight loss, arthritis and malaise. But in about 50% of the patients, a characteristic erythematous rash will develop over the malar region called as butterfly rash. So this picture depicts the typical butterfly rash on the malar region. And as I said, this is a systemic condition. So other organs also will be affected. The kidneys will be affected in about 40 to 50% of the patients, leading to kidney failure. Cardiac involvement is also a very common complication. At autopsy, 50% of the patients will reveal some vegetations on the heart valve, and these vegetations are called as Liebman-Sachs endocarditis in SLE patients. Oral lesions will affect the buccal mucosa, palate and gingiva, and vermilion border of the lip is also commonly involved, called as lupus cheilitis. So in this picture you can see the erythematous lesions on the hard palate and then even on the buccal mucosa and everything. This is one another lesion on the buccal mucosa. And there is one more condition called chronic cutaneous lupus erythematosus. This is also called as discoid lupus erythematosus. This will appear as scaly erythematous patches. This commonly occurs in sun-exposed areas like head and neck. But the only thing is, this will heal with scarring. Scarring will be either with hypo or hyperpigmentation. And oral lesions will appear as an ulcerated erythematous central zone surrounded by fine white radiating striae. So here you can see only one area on the face is affected. Discoid means this is a localized form. Subacute, as I said, the clinical manifestations will be intermediate between systemic and the discoid form. And histologically, skin lesions will show hyperkeratosis, and often the keratin will be seen packed into the openings of the hair follicle, called as follicular plugging. And oral lesions also will show hyperkeratosis, acanthosis and inflammatory infiltrate. So, if you take a direct immunofluorescence in case of lupus erythematosus, some antibodies like IgG, IgM and C3 complement factors will be seen in the lesional tissue. But in SLE, apart from the lesional tissue, even in normal skin, you can find these deposition of antibodies at the basement membrane zone. Normal skin also. So this is called as positive lupus band test. This picture shows some diagnostic criteria for SLE. There is one more autoimmune disease affecting the connective tissue called as systemic sclerosis. This is also called progressive systemic sclerosis, scleroderma or hidebound disease. Here also connective tissue is affected. Apart from that, vascular tissue is also affected. And this is also very common in women, occurs in adults. One of the first sign of this disease is Raynaud phenomenon. That is a vasoconstrictive phenomenon. And there will be resorption of the terminal fingers or the phalanges called as acro-osteolysis, and this will lead to contractures and along with that there will be contractures leading to shortened claw-like fingers, and the vascular events will produce ulceration at the fingertip. So these are the claw-like fingers, these are the ulcerations of the fingertips, and this disease is also called as scleroderma. Sclero means hard, derma means skin. So the involvement of the facial skin by subcutaneous collagen deposition will result in characteristic smooth mask-like facies, and nose will be involved, leading to a mouse facies. So you can see here involvement of the face leading to a mask-like facies. And limited cutaneous systemic sclerosis means skin changes will be confined to hands, face, feet and lower portion of the limbs. Diffuse cutaneous means trunk and proximal limbs also will be involved. And oral manifestation, there will be microstomia as a result of increased abnormal collagen deposition, and there will be limited mouth opening. Tongue will be involved, leading to a board-like tongue, and there will be characteristic furrows radiating from the mouth, producing a purse string appearance. So here is the microstomia produced due to the abnormal collagen deposition. Dental radiographs will show a diffuse widening of the periodontal ligament space. There will be, all teeth will show a diffuse widening of the PDL space. And there is one localized form of systemic sclerosis called scleroderma, localized scleroderma or morphia. It affects only a solitary patch of skin, and so it is also called a scoop de sabre or strike of the sword appearance. Like if you see here, the forehead alone, one area is affected. Here also at the forehead, strike of the sword or coup de sabre appearance. Histologically, there will be deposition of dense collagen. There is one more syndrome called as CREST syndrome, which is where C stands for calcinosis cutis, R stands for Raynaud's phenomenon, E is for esophageal dysfunction, S is for sclerodactyly or scleroderma, and T is for telangiectasia. So this is calcinosis cutis, Raynaud's phenomenon, E is for esophageal dysfunction, and sclerodactyly and telangiectasia. So with this, skin lesions are over. If you have any doubts, kindly feel free to contact me. Okay.